So obviously we're a telemedicine company, and that's at the core, and looking at new technologies, but healthcare innovation in telemedicine means more than just that technology piece of things. How do you think about that as an advantage to what Avel is doing, looking at more than just technology, bringing in that clinical expertise, et cetera?
Yeah, I think we're fortunate we live in a time, especially post-COVID, where the technology side of telehealth has kind of gotten so much more affordable, so much more robust than it ever was before.
Yes.
I think when we first started, and it was a little bit before my time, but one of our physicians, Dr. Jacobs, would say, yeah, that unit cost us like $100,000, the first telehealth cart we put in place, which is just amazing to think about.
Wow.
And now, for $1,000, a couple of $1,000s, you can get a really robust piece of technology.
Wow.
And so for us, the technology has kind of gone to the side in a lot of ways. And now all my technology partners at Avel are going to be giving me the side eye because they work so hard to make sure that all works in the background.
Yes.
But it's really about the process innovation and the business innovation and like leveraging this powerful technology that we have and these platforms that we have then to make sure we can be where we need to be just when it's appropriate. And so when we're in an emergency room, it's that idea of I need help now and I just need help. Like I just want to say I need help and it's in the room.
Yes.
And so we've made that as easy as possible with the push of a button. But it's really about making sure then you have all of the pieces behind the scenes, the people ready to go to take that call, the physician ready to understand which community they're working in and what capabilities they have, who they're talking with on the other side so they can have that quick connection and step in and support. So for us, the technology has been an important piece of the pie. But I really look at my team sitting in the middle of, what can we do clinically? And then from a compliance perspective, what compliance pieces do we have to keep in mind? So making sure we get consent and we're documenting and we've got secure flow of information. What from a contracting perspective do we need to consider? What are the state licensure or all prescribing laws? And so it's pulling on all these different kind of functions or departments within Avel to actually create that innovation and make it possible. How can we do all this affordably? There's that, you can do anything with enough time and money. But what we know is that our customers want this to be cost effective and it has to be cost effective. So how do we do it at a resource level that's going to be efficient for everybody involved? And I think of that as really truly the innovation piece. It's pulling all that together. And sometimes I think of it as a spider web, literally, where you're kind of tugging on all the strings. Like, how do you find the right balance? So you got the cost point where it's sustainable for everybody, but you've got enough of service and that, warm human touch involved that it's going to make a huge impact.
Yeah. When you talk about keeping patients in the hospital, what does that mean for a community or for a rural health facility?
We estimate that the average revenue associated with one inpatient stay is about $10,000. And when you look at a hospital whose budget may be fairly modest, some of our smallest hospitals, it's maybe even less than $5 million. That $10,000 goes a long way to being able to keeping their nursing staff fully staffed, to making sure that they've got training and resources available to their team. But every patient that stays in that community is a financial benefit to that hospital. But you think about that patient. Most certainly they have a spouse, a family member, a daughter that is in that community. And if they're leaving and going 60 miles, 120 miles to the nearest tertiary care center, it's very disruptive for everybody in their life. And they may find themselves healing in a hospital bed very far from family and alone. And so being able to stay local is huge for everybody involved. We also know that as you begin to care for sicker patients, you're getting that confidence, you're getting competence. And so that next patient that is admitted, you're more ready for that patient as well.